Hey, everybody, and welcome to the Dr. Mom Show. This is Dr. D, mom of three, your host of the Dr. Mom Show. Thank you so much. Whether you're listening today or watching the show, we appreciate you joining us because I have a fantastic guest today as we wrap up our February session where we're talking about matters of the heart, which is so important on multiple levels. And as you have learned this month, not only physically, but emotionally, our heart can be affected. So again, I hope you're having a fantastic 2021 because on the Dr. Mom Show, we want to continue to drop you nuggets so you can have an amazing 2021, and that's WON, so we can make some wins this year and make it a better year than 2020. So of course, if this is your first time checking out the Dr. Mom Show, make sure you go back and listen to previous episodes, to the experts and the awesome guests I've had on, and some other topics that I've talked about on the show. And of course, before we get into today's show, just a reminder that the Dr. Mom Show is a medical informational resource. It does not take the place of your physician or your child's physician. So please seek your medical advice and your child's medical advice from your physician or your child's physician. So today, again, I'm excited as always when I'm on this show to have such an amazing guest today. And I'm so grateful that she is taking the time out to share her story with us because, again, all month you've heard me harp on the importance of just your heart. And of course, February is American Heart Awareness Month. So we're being more aware. It should be every day that we're aware of our heart, but we're just being more aware and hyper vigilant about our heart health that we've been talking about. So today, again, help me welcome my guest, Ms. Joan Baumgarth. Woo!
Yeah, thank you.
Awesome. So excited to have her on. As you know, again, today's show is Matters of the Heart, how I survived my heart attack. And Miss Joan had a heart attack. It was very recent in the past 3 months at the end of last year, 2020, not like 2020 wasn't already crazy. And then she unfortunately had to end her year off. You know, normally we want to end our year off on a high note, but she ended it off with a situation that definitely has changed her life in multiple ways. And that's what she's going to talk about today and share with you just her experience. And again, here on the Dr. Mom Show, we want to help you because we want to prevent, you know, I love that she's sharing her story so she can help others out there prevent going through what she went through. So I'm so glad she's here. So just a little bit about Ms. Joan. She's a 56-year-old amazing woman who is an ordained minister and one of the coaching queens of Coaching Queens 2020. So you definitely have to check her out.
Yes.
She is a wife of 16 years. Woo woo. We love long marriages here. And this month, as you know, we've been focusing on relationships because it's the month of our hearts. And she is a mother of 2 beautiful children. And not only that, you're hearing it here live and direct that, you know, Miss Joan is going to be back on this show because today she's focusing on her heart attack. But Miss Joan has had MS or multiple sclerosis. For those of you who don't know what that stands for, it is a neurological disease that affects the nervous system for 10 years, and she's been doing great. So she's somebody who will for sure be on the show again to share her experience with MS. But again, today we're focusing on the heart and how she survived her heart attack. So again, help me welcome Miss Joan. Woo, woo, woo.
Thank you. It's great to be here.
Good. Well, tell us a little bit more about yourself and what you do.
Well, I work, like you said, with the Coaching Queens 2020. There's 3 women, and I'm the ordained one. And we talk about helpful topics it originally started through the quarantine. And we wanted to help people out that were depressed and so on and so forth. But I also volunteer with the Red Cross. I'm on the disaster action team to where I respond to people that lose their homes in fire or floods. And I am on a spiritual team. And that's where the ordained came in at. And I've been dealing a lot with the heart attack. So that pretty well sums it up. That takes a lot of my time.
Yeah. Well, I love that. And thank you. You know, right now, as a physician, we've seen so much mental health concerns and issues go up since the pandemic. And, you know, they continue to rise not only in adults, but in our kids. So, you know, hats off to you, you all, and your counterpart coaches who are taking time out to really speak with
Thank
people
you.
and help encourage them, because it is important. So many people, I mean, it's really sad that, again, you guys always hear me say, you know, people who've suffered from anxiety or depression, that's just really shot up. And then there's people who've never had issues like that, but you know, you look back and it's going to be a year pretty soon for us, at least where I am here in Missouri, that, you know, but overall in the United States, it's been about a year that some people have been in isolation. You know, I have some patients who have
Right.
not left their home since this started, and you know, they're ordering groceries, you know, their kids are helping them do other things, and you know, that'll get to you. That, I mean, it's hard
It
to live like
does.
that.
And we love to laugh. We love to
Yeah.
laugh, and we hope that we share that with other people and lighten things up a little bit.
Well, I love that you all are doing that. Keep that up.
Okay.
So awesome. So now we're going to get down and dirty in here.
Okay, here we go. Here we
We're
go.
going to talk about your heart attack. So again, you suffered this heart attack about 3 months ago. So tell us the scoop. Tell us what happened that day, how you were feeling, what led up to it.
Well, the Monday before the Friday, it was Friday the 13th. The Monday before I had fallen due to MS, my legs got tangled up and I fell and I twisted and turned and I thought I had a sore muscle in my chest. So I was thinking that the pain, I had to go to the hospital, had a concussion. I mean, I went to the hospital a lot that week, but I had pain and in the chest, I would say on a scale from 1 to 10, it was a 3. Well, come Thursday, I should have listened to my gut, but I knew that it was something different. I just knew that it wasn't getting any better. And I thought, you know, I'm probably going to call the doctor tomorrow. And I was thinking my MS doctor because I thought it was either something with the fall or something to that effect. So Friday came, hunting season, if anybody's into the hunting season. It was November 13th. Husband was ready to go. I know, poor Bambi. Um, and I wanted, my husband was going to be going out of town for that weekend, and he was a little worried about my chest. So I thought, okay, I called up the fire department and I talked to the fire chief, which in a small town, you get to know who they are. And he said, if you're having a heart attack, let's come out to you. And I said, okay, well, I don't think that I am, but come on out. I was a smoker. And I had a cigarette and the pain got worse. And that's what made me really concerned. And so the ambulance came out to check me out. EKG was fine. There's an abnormality that they're concerned about. I'm not sure what they said. Some about a depression. I think that it was okay.
Like a T-wave or ST depression, maybe.
And they didn't seem too concerned, so I sent them away. I said, okay, I don't need that.
And not to stop you, for those of you who don't know what an EKG is, an EKG is when they put those little stickies on your chest, and then it's a few seconds. We see the rhythm of your heart during that window of a few seconds, and you know, those are all those squiggly lines. So that's what she's talking about when she's talking about her EKG.
Okay. So my husband came home after that, and I was on the phone with my doctor because he wanted me to call to make sure it was okay. He wasn't going to leave. And I fainted when I was on the phone. I sneezed, which was really funny. I mean, not funny, haha, but just odd.
Yeah.
And I woke up and I was in a recliner and my husband's rubbing my chest and I got somebody saying, Joan, I was completely unconscious for a minute. So the ambulance came back out and they knew that they would. And I went to the hospital and I felt fine after I fainted. But the pain had more or less subsided after that. But I still went to the ambulance and they're going to send me home, but maybe you can explain again to me the troponin. Is that how you say it?
Yes. So the
It's a
troponin is one of the blood tests that we get. It's an enzyme that's released from the heart. So what happens if something's going on with the heart? So for example, if you are having a heart attack, because remember the heart is a muscle. So if something is happening to the heart, we'll see that troponin, that number trend up. And a lot of times it may not be the first number that goes up. Usually we check it 3 times, kind of depending on a hospital policy. And it's about every 6 hours they check it, because then after a while it may trend up. And just a disclaimer, there's some other things that can cause hydroponins, falsely elevated troponin. So like, for example, kidney failure can cause an elevated troponin. So those are things, when the physician looks at the labs, that's why we have to look at the whole picture. But, Miss Jones' case, she was coming in having this like chest discomfort, and now she passed out. I mean, this is just building up here.
And there were a lot of blood tests that they
Yes.
did, but my level kept going up, and they said, sweetheart, you had a heart attack.
Yeah.
So I got admitted into the hospital, and I was there for 5 days. They did an echocardiogram on a Sunday, and Monday they did the heart cath, and come to find out I had an artery that was 99% blocked and a stent put in.
She's right there. She's right there. Oh man.
And then they did a new procedure to where I only had to lay down flat for 2 hours. The new procedure, how they close up the wound, I guess, when they go up through the leg. And then I went home Tuesday, and I went through elation that I was still alive. Then I went through fear that something was going to happen to me in my sleep. And now I am at a level to where I am grateful. People say Friday the 13th is a bad luck day. I'm telling you, it's not. I survived.
That's right. Amen.
And it's not whether the glass is half empty or half full. I'm glad I have a glass.
That's right. Oh, I love that. I love that. I love that. So true. And just to backtrack a little, Ms. Joan talked about her echo. For those of you who don't know, an echo is it's an ultrasound, kind of like how when women are pregnant, you get that cold gel on your tummy. So they put it on your chest, and it's just an ultrasound of your heart. So it's showing how your heart functions, how the valves look, the different chambers of your heart, that they just take a look at that. And then, of course, you mentioned the cardiac cath, and there's 2 ways they can do it right now. They can either go up your groin, or they can go through one of the arteries in your wrist.
Right.
And essentially they go up there, they shoot dye, and how they shoot dye is it's pretty cool, because it's almost like an x-ray, that when the dye goes up, they see if the dye passes through all the vasculature, so the vessel. So that's how they know that a vessel is stenosed, or it's clogged, or whatever the case may be, and they're able to open back up. So it's really cool. I'm sure you guys could YouTube those videos, that when they put the stent in there, they shoot the dye again, and it's pretty cool, because then you see that vessel open up and how the blood flows. And it's amazing how God created our bodies, because a lot of times, sometimes people come in with a heart attack and they've had that stenosis for some time. For people who, like Miss Jones, she kind of acted pretty quickly. She waited a little bit, but there's people who come and they've had pain for weeks and keep putting it off. And what happens is the body makes what we call collateral vessels. So essentially it makes like other baby vessels to help, because your blood is blocked. Like she talked about, she had that blockage. So these other baby vessels form to help, us go into survival mode. Those are kind of just some of the things she's talking about that she went through. And obviously it has changed your life, because look, you said, I'm glad I have a glass, which is true. And I, for those of you watching and listening, I feel that's something to take, for sure, a take home message, that, we wake up every day, and even in the midst of things like COVID, every day I'm so grateful, working in the medical field, that God has continued to preserve myself, my husband, my kids, my family during this time, because we're like, they're up in it. And a lot of times we forget, and we still complain about little things. And, a lot of times we forget to say, thank you that I have the home I live in, that I have clothes, that I have food, that I have family, loved ones. I know Ms. Joan, when I spoke with her, she just said, I have such a good support system, and I feel that means so much.
It means a lot. It means a lot. I had my husband, bless his heart, gave up hunting, which he had no problem in doing. But with COVID, you were only able to come to the hospital from 10 to 6.
Yep.
And he stayed the whole time. And my mind just went blank. But I do have a wonderful husband and support and two wonderful kids that helped me through this. And I'm blessed by God. I mean, he's given me another chance. And
That's
one of
right.
the main things is what I want to impress is I have MS and I was feeling lousy. And I kept thinking that it was fatigue, which is a nice fancy word for tired. But I kept getting tired and I thought my MS was getting worse.
Mm.
And I just can't stress enough that when you're not feeling well, get checked out by the doctor. Don't automatically assume.
Yep.
And
And
because I'm feeling great now.
yep. And I think that's so important, because if it's okay, can I ask you, like, when was the last time before all this happened that you got a checkup?
I only have gone to my MS doctor. I've not had a checkup.
Primary care, yeah. So, and this is like no reflection on Ms. Joan. I think overall that's kind of like the average individual, that a lot of people, especially in women, I've seen in women that they'll see like their OBGYN only, and they don't have a primary care doctor. And they're like, oh, well, I go for my PAPs, and they consider that their physical, but it's not. And you guys have heard me say this before, that even if you don't like going to the doctor, at least once a year, make it your duty to go for your physical, so you get a head to toe checkup in addition to getting your blood work. Because I don't know, Ms. Joan, did you have, I'm sure they checked your cholesterol. Was your cholesterol high?
It was somewhat high. My triglycerides were high, but they checked it on the 13th, the day that I had the heart attack. I'm sure it's
Okay.
lower now. I'm
Yeah.
sure it's lower now because I am more active. I am on my bike. I do 5-minute intervals. I'm in a recumbent bike because my balance is off because of my MS.
Yeah.
So
Yeah.
I'm in a recumbent bike and I do it 5 minutes throughout the day and
Yeah.
stuff because I can't get my heart rate up because of medicine that I'm on right now.
Yep. And
So
and
it's
that's go ahead.
no, I was done. I just with the exercise and doing, I think my cholesterol is a
Is
lot lower. My
better.
eating habits have changed, and
Yeah. And it's so important, because, if like Miss Joan was my patient, and if she came for her physical, one thing she probably would have gotten from any primary care doctor she went to was, because of the her risk of her smoking increases her risk of heart attack. Of course, we always ask about family history, if there's any family history of heart attack. And then depending at that point, how her blood work looked. And now, one nice thing about medicine is just there's always research being done. Medicine is such a changing field, literally, like every day. That's why we have to read our medical journals to just keep up to date with what's going on. And it's like tricky, because you have to do that. You can't just stick with one thing. But it's
right,
nice, because as they keep doing research, we're learning more and more things to give better care. Essentially, that's the point of all the research. And I mean, just with the cholesterol alone, we're able to calculate somebody's risk of having a heart attack. So instead of just saying, oh, your cholesterol's high, we're going to give you some medication, or change these habits, we're able to say, like, hey, your 10-year risk of having a heart attack or stroke is this amount. So at this point,
right.
we are recommending. And I think it's nice as a patient, because I know as doctors, we get a bad rap, because people always say, you guys just want to use medication, and for those of you who watch the show, you know, I'm that's not how I practice. I really prefer to have a conversation with my patient and have them understand and be on the same page, because what I've learned is patients are more compliant and do what you ask them to do if they agree with what's being done. And unless it's some sort of like life or death situation where it's like, oh, you know, if we try like 3 to 6 months of diet and exercise, and then if we don't see improvement, then we can consider medication. You know, I think those are things. And again, this is why it's so important to have that relationship and conversation with your doctor.
I do now. I do now. I do now.
I'm
And
sure.
I was adopted. So I mean, as
Oh
far as
yeah,
family history goes,
that yep,
I had no idea. I mean,
that
I don't.
that makes it tricky. That does make it very hard in regards to that side of the risk factors, because now I know Miss Joan and I were talking, you know, for anybody out there, again, you should have this discussion with your physician if there is a family history of early coronary artery disease, heart attack. You know, now we have special imaging and a test that can be done that helps assess your risk of early heart attack. Because I know Miss Joan, when we talked, she was like, I don't know why they can't just, you know, screen everybody. And you
Yeah.
know, I feel the same way. It's really hard, because the same thing happens for those of you who've seen these young athletes just collapse, and at the end of the day, they have what's called hypertrophic cardiomyopathy, or HOCM. And there's been multiple studies done about, you know, should we do an echo on every athlete in order to not have these cases happen, or to find out if that's what's going on. And essentially what they found is not cost effective. If we screened everybody, it would be so much money that the cost would be so high, and for the results it just isn't feasible. So what we do is we just screen a lot better. So when kids come for their physicals to me, I always ask, have they passed out while they're playing a sport? Do they get short of breath? Do they get chest pain? You know, so you just really screen. Now, if a kid is having that, you screen them. So for example, if Miss Joan came to a doctor and she was like, I am having some chest pain, I am, you know, feeling short of breath, you know, of course
Hmm.
she's going to get that full workup for chest pain, because we really try to push that forward. So well, let me ask you, before everything happened, had it ever crossed your mind of like a heart attack, or you having a heart attack, or being at risk of a heart attack?
No, well, I knew smoking was unhealthy, and I have to tell you, it's been 97 days since I've had a
Woo!
cigarette. So, yay!
Congratulations.
And because that scared
Congratulations.
me, but I had no idea. In fact, the doctor said I was younger than most
Oh yeah. Yeah,
heart
you are
attack
young.
patients, and which is nice to hear that I'm young. Yay! But I had no idea. I had the thought didn't even cross my mind.
Yeah. Yeah. And you know, that's what's tricky with things like heart attack, stroke, things that kind of just hit. And I think most people, you know, we always think it's not going to happen to us. I mean, that's just kind
Right? You
of,
just
you're
don't
kind of
think
like,
it's going to happen.
yeah, yep, exactly, exactly. And
I'm on a
um,
quit smoking site on Facebook support group, and I can't stress enough. I've had a heart attack.
yeah,
They have to understand you don't think it's going to happen to you. You
that's
hear these
right.
stories, and you think you're invincible. And I've been blessed. I mean, I just I'm not scared to die, but I'm scared because I don't want to go.
Yeah,
You
yeah,
know, and that's what the anxiety that I was dealing with was, that Friday night my husband couldn't come in with me after I was admitted to the hospital. So I'm thinking, okay, it's a good sign they're not in the room working on me, so I guess I'm okay.
yeah.
But I just thought, please God, I did a lot of praying, and it was like, please, just, I'm not ready to go yet. I had a minister tell me one time, if you're not dead, you're not done. So there's still some more work I need to do.
That's right. That's right. You have a purpose that God has ordained in your life, you know, and you're already doing that in regards to helping people with anxiety with the pandemic, but now you also have turned your pain into purpose of what you've gone through with the heart attack. And again, I just love that you're doing that, because you're right. God, sometimes we get a little upset at God and say, why are you putting me through this? Or why did I go through that? But a lot of times he ends up using what we went through for us to be a testimony to
There's
others.
exactly, he takes the bad and brings something good out of it. There was one where I heard, when you take a test, the teacher is quiet. So you sit there and you go through what you need to go through. But I met you. I mean, the blessings still come.
That's right. That's right. I said divine connections and divine collaboration. That's right. So how do you feel the heart attack has changed your life and your outlook on life as a whole?
Well, I'm eating better. I wasn't eating bad. I wasn't eating.
Mm,
So I had gained weight. I don't know if it was because of medication that I'm on, but also I was eating and it was getting stored toward fat, because I would eat like breakfast and then I would eat dinner.
mm,
So now I'm eating every 3 hours. I have a nutrition shake. I am taking some vitamins that help, some CoQ10 and stuff like that helps with the heart and the lungs. I'm nutritional shakes, and I do eat, normal during the week. So that has changed. As far as my outlook on life, I just somebody said, I bet you feel lucky. I feel blessed. I
that's
mean,
right.
I'm here for a reason,
Mm,
and I'm not sure what that reason is. I don't know if it's going to be something big or even something small, as to share a smile to someone who needs it. We're off topic a little bit, but during Lent, we're doing the red letter challenge, and I'm looking forward to that, and grateful that I can do it. I'm excited about doing
yeah.
it, and is it things the small things don't bother me so much.
Mm. And I think that's great that, again, that you're just taking what you've gone through and you're turning it around and impacting people. And I agree with you. I always say, with everything I do, even if it's like one person's life I change, like ultimately my goal is to impact and touch a million people's lives. And whether it's I
Right.
impact 100,000, and then in turn they impact others from what they've learned from me to equal a million. But if it's even one person, it's worth it. If you help one person out there not to have a heart attack, or to realize that they should be grateful that they even have a glass, sharing your story is for sure worth it.
Well, thank you. It's like the starfish analogy. Remember that story, to where the little girl was saving the starfish back into the ocean, and he said, "You're never going to get it done." She said,
Yeah,
"But if I save
that's right.
just one, and listen to your gut. If there's something that's going on, don't talk it away, saying it'll go away or it's no big deal. Listen to your gut."
And I think that's so important. And I just want to say that as a women, and again, you guys heard me talk on that episode. If you didn't check out my episode about matters of the heart disease itself, that a woman's heart matters, I go into detail about heart disease in women and like signs and symptoms, and what you can do to help prevent having heart disease. And part of that is that as women, we do not have that textbook chest pain that men
No.
have, where, again, if you read a textbook or you Google, heart attack online, it's going to say left-sided chest pain radiating to the left arm, maybe some nausea or vomiting, radiating to the jaw. A lot of times some women, it'll feel like reflux. They're just kind of like, oh, I just feel right in here, there's something stuck. Sometimes they'll present just with some back pain. We've had women present just with back pain, or just not feeling well, like how Ms. Joan talked about. She just felt
It was just at the
tired.
sternum. Yeah,
Yep.
and tired, and I'm sorry. Go ahead.
No, 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 no. Yeah, no, exactly. That, you have to remember that everything isn't textbook, even though we have, I'm going to take Miss Jones, MS, for example. I've had young women present where just, again, this is textbook, that anytime they exercise or work out, all of a sudden they get like weak. Like they're just like, I can't work out as long. But then I've had people who just present with numbness and tingling. Then I've had people who their first symptom has been change in their vision. And when they see the eye doctor, that's how they get diagnosed, because the MS has affected the nerves of their eyes. So again, everything isn't textbook. And that's probably like one of my pet peeves about people Googling. Like I love that there's information out there, but I feel sometimes that can lead you astray. So that's why it's so important that you have a primary care doctor. And if something's going on, call them and just say, hey, this is going on. And I'm sure your doctor will check you out and kind of triage you, how, do whatever workup is needed. But again, you women who are listening out there, heart disease, definitely, again, a number one killer, leading killer in the United States. Number one, before cancer, of all the cancers that we have, heart disease still trumps everything else as the number one killer. And like I said in the previous show, it does not discriminate. It does not matter what your background is, what your skin color is, it's going to come after you if you have risk factors. So definitely, if you're a woman, just be more vigilant. If you are, just like Ms. Jones said, to listen to your gut and don't put it aside, because we're great at that as women, because we have 100 things on our list to do, and who's going to get it done if we don't get it done? But exactly. A lot of times we need to stop and take time for ourselves too.
Exactly. Listen to your gut. My gut has never steered me wrong. Never has. I haven't listened to it all the time, and it's got me in trouble, but you listen to your gut.
Awesome. Well, I love those words of wisdom. Anything else to the audience, our listeners and viewers today, that you want to share, and just leave them some last words of wisdom?
Oh, I have a lot of Joanisms. I have a lot of stuff that I could share.
I love that.
A lot of Joanisms, but the half empty, half full, and just glad I have a glass is one of them. And be thankful. The small stuff, God already has things planned.
That's right.
And I did a Bible study on worrying, and I can go to Psalms and I could do all that stuff, but I won't. But I just be still and know that He's God, and He's got it. The plan is already in place, and you just need to navigate, and you'll be fine.
Yeah, and I love that. And I encourage you to, we always forget when we're put in a situation, we are very fast to blame God, but remember that we also have a responsibility of, making good decisions of how we take care of ourselves, what we do. Because there's, of course, genetics, we can't change our family history, but how we live, the lifestyle we live, how we eat, how we exercise, if we do things like smoke or only drink soda, things like that, things that are going to increase our risk, that's our decision, of how we want to treat ourselves. And I also just reiterate, not worrying, the Bible says that there's enough worries today, so don't worry about tomorrow, because there's enough today.
There's enough going on today. Quit rehearsing for scenarios that aren't going to happen.
Exactly. So each day God has us, and He promises that if He takes care of the birds of the air, the fish of the sea, the flowers of the field, even more so, He loves us more than all those things, even more so, He will take care of us. That's what He promises us. And I mean, that's what He does. So we have to do our part and take care of ourselves too, make sure we make the right choices. And then, of course, if you want to get any more of Joanisms, which I love, that remember, be grateful that you have a glass. You can connect with Ms. Joan. You can connect with her on Facebook. It's just her name, Joan Baumgarth. And then, of course, the Facebook page for her coaching, Coaching Queens 2020, a little trio going there with herself and some other counterpart coaches.
Yes.
Or you can email her at roadscholar2006@gmail.com if you want her to be a speaker, if you want her at a workshop or a seminar, if you want her on your podcast, or if you just want to talk to her and be like, Miss
I
Joan,
would love
I
it.
had a heart attack. Yeah. So she's so sweet. She's amazing to talk to and so easy to speak with. And I love
Now
how,
remember
again,
though, it's ROAD, Road Scholar.
ROAD. Yes.
ROAD. We can't do the Road Scholar RHODE because there are road scholars. We can't do that. So we got to do the road
She's a road,
ROAD.
like regular
Yeah.
road, like the
Like
road
the
you
regular,
drive
like
on.
street smart.
That's right. She's
Yeah.
street smart. So for sure, definitely connect with her. Don't forget to share this episode for any woman that you know out there so they can hear Miss Jones' story and be able to take better care of themselves. Because of course, if people don't have that knowledge, they don't know. If people don't know, they just don't know. So that's why I want you to share the episode. Make sure you be more diligent about how you live and how you eat. Again, Ms. Joan, thank you so much
thank you
for being on the show.
Thank you. I've enjoyed it immensely.
Awesome. And then thank you all, of course, for joining us. Again, don't forget to check out the Dr. Mom Show on the YouTube channel and subscribe. Like the video, share the video. Also check us out on multiple podcast platforms, including Apple Podcasts, iHeart Radio, Spotify. Don't forget and like it and leave a review. Remember, your mama said don't say bad things if you if you have something to say. Make sure it's nice. So leave a nice review or else just don't say anything at all. And then, of course, don't forget to follow me on Instagram at drmom_show. And of course, don't forget to check out drdaleemushalak.com to get your freebies. Again, right now, I have some immunity guides up there. You know, we're still in the season of flu. We got COVID going on. What better ways than to keep your immune system nice and strong? So check that out. Like I said before, I'm working on some things for mental health, just some freebies to help, some things that you can do to keep your mental health up. So that's on the way. And then, of course, you know, I'm all about turning your vision into legacy with Alea Publishing. If you're thinking about writing your story, which you know I'm a firm believer in, I feel that everybody has a story to tell. And it's just a matter of taking time out to tell your story, because each one of our stories will speak to somebody out there. And you know,
Yes.
I am totally a proponent of telling your story because it will make a difference. So if you are interested, whether it's a book collaboration, a children's book, a devotional, your story, definitely check out aleapublishing.com to tell your story. And then, of course, don't forget to join my female Facebook group, Fulfilled Females. Whoop, whoop, where every day we're doing challenges, having a little fun, just interacting and supporting each other. So, of course, thank you again, Miss Joan. We appreciate you so much.
Thank you.
And, you know, stay healthy.
I'm working on it.
Keep up the good work. And then, of course, congratulations again for going 96 days. And she stopped cold turkey. I mean,
yes, I did. I didn't even do a patch. Yeah.
She stopped cold turkey. So she wasn't messing around. So you should be so proud of yourself for doing that.
I'm excited.
So amazing. So everybody out there, don't forget that you are beautiful. You are strong. You are amazing because you are a superhero. And remember to always have faith over fear. And as Dr. Mom always says, don't forget to wash your hands, kiss your kids, love your families, and say your prayers goodnight. Love from Dr. Mom Show. Bye.
Bye, everybody.